Did you know that tilting your head just 45 degrees to check your phone puts as much as pressure on your neck carrying 25 kilo backpack every single day? Text neck, all you need to know. Let us know definition. What happens to the neck during the text neck? Why it is risky? Symptoms, investigations, precautions, treatment, and summary. Coming to the definition. Text neck is a modern spinal problem caused by looking down at your phone or screen long period of time like this. When you bend your head forward and it puts extra pressure on your neck muscles and spine. This is unnatural posture, can strain the neck, shoulder, upper back. Over time, this leads to stiffness, pain, even early wear and tear changes in your spine. Many people, especially those using smartphones, laptops for hours, are affected by it. Text neck is common in teenagers and office workers. It can also cause headache, eye strain, fatigue. If it is not corrected, it may lead to long-term spinal changes. The good news is it is preventable with simple postural changes. What happens to your neck during text neck? Text neck happens when head is bent forward too long, like when you are looking at the phone. Human head weighs around 4 to 5 kgs, but by tilting it forward increases the pressure on the neck. At 60 degrees, your neck feels like it is carrying almost 25 kgs. This pressure strains the cervical spine, which includes the top 7 bones C1, C2, C3, C4, C5, C6, C7. The neck muscles like trapezius, levator scapulae works extra hard to support your head. Over time, this can cause muscle fatigue, spasms, and even inflammation. The discs between your neck bones can also wear and tear changes appear, can lead to disc bulges and herniations. The nerves passing through the neck may get pinched, causing pain and tingling sensation in the shoulder and arms. Even your postural changes can lead to forward head, rounded shoulder. This chain reaction in the body is why simple habit like looking down too often can cause serious neck and spinal issues. Why text neck is risky? The text neck may seem harmless at first, but it can cause serious long-term spinal problems. The disc prolapse, nerve pinching, slip vertebra, and cervical cord compression and damage. That's why ignoring text neck today can lead to big spinal problem tomorrow. Let us know some 20 symptoms of text neck that people commonly experience. Neck pain, stiffness in the neck, shoulder pain, upper back pain, headaches, tingling and numbness in the arms and hands, muscle spasm in the neck and shoulder, reduced neck mobility, pain between the shoulder blades, eye strain, fatigue, tiredness, poor posture, forward head posture, difficulty in concentrating due to discomfort, increased tension in the jaw, tension headaches, burning sensation in the neck, sleep disturbances due to neck discomfort, dizziness in some cases, pain while using phones or laptops for long, a pulling feel in the back and neck and shoulders. These are the few symptoms. Coming to the investigations of the text neck. 1. X-ray. This helps in detecting early signs of spondylosis or degenerative changes or aging changes related to the chronic strain. X-rays are quick and cost-effective first step for evaluating posture-related neck problems. X-rays also shows alignment of the cervical spine, which can reveal loss of neck curve or bony changes. Normal curve of the cervical spine is C shape. If it is curved in the opposite direction or it has become straight, it can be detected on X-ray. MRI. MRI is the gold standard for diagnosing any spinal problem as of now. And MRI provides detailed imaging of the neck and soft tissues, discs, nerves, and spinal cord. It helps detecting disc bulges, herniations, and how much compression is there, whether it's a midline, lateral, right side, or left side, and which is caused by poor posture. And MRI is especially useful if symptoms are severe, persistent, and associated with neurological signs. Coming to the CT scan. CT scan gives more detailed view about the bony structures of the cervical spine. They can identify bony spurs and joint degeneration and spinal canal narrowing, which is not seen in the X-ray. And CT scan is often useful in the any bony injury is there or complex bony changes are suspected. And nerve conduction studies. Nerve conduction studies will tell us how nerves are in the arms, hands are working. It helps diagnosing nerve compressions, pinching nerves due to text neck or disc problems. This test is useful if patients having tingling, numbness, weakness in the upper limbs. Coming to the treatment aspect of text neck. Posture correction. First, posture correction. Keep your phone or screen at the level of the eye or slightly down and reduce the forward head tilt like this. And frequent breaks. Follow 20-20-20-20 rule. 4 times 20. Every 20 minutes look 20 feet away for 20 seconds and blink 20 times. 3. Stretching exercises. Do gentle neck exercises, shoulder rolls and chin tucks to relieve tightness. 4. Strengthening exercises. Strengthen upper back, neck muscles to improve the posture support. 5. Ergonomic setup. Adjust the chair, desk, screen to maintain neutral spine. 7. Pain relieving medicines and take as per doctor's advice. If pain is severe, you can use anti-inflammatory medications if your doctor is advised. 8. Physiotherapy. As a physical therapist can guide you to posture training and custom exercises. 9. Digital detox. Limit your screen time whenever it is possible, especially children and teens, and make it a habit from 9 p.m. to 9 a.m. No gadget zone and no gadget time, and instead of that you can read a book or you can spend time with the family. 10. Mindfulness and habit tracking. Use reminders or apps if it is become aware of the posture and avoid looking down for too long. The red flags of the text neck. Whenever neck pain worsens after phone or screen use, or stiffness in the neck especially after waking up, shoulder or upper back pain, frequent headaches especially at the base of the skull, tingling and numbness in the hands and arms, and forward head posture, head is projecting out, and pain while looking down for long periods of time, and reduced movements in the neck and upper spine, and tiredness in the eyes and blurring of vision from poor posture, and improved relief when holding the phone at the eye level. These are the red flags one should be aware of and take steps. And what about the surgery? Surgery for the text neck in very severe cases. Surgery for the text neck is rare, may be needed if there is a severe cervical disc prolapse and causing severe spinal cord compression, causing myelopathy, that means changes in the spinal cord, and persistent nerve pain and weakness. If it is not improving with the medicines and physiotherapy, we will consider surgery. And common surgical options for text neck surgical indications are: one, anterior cervical discectomy and fusion, in which removal of the damaged disc which is causing the pressure over the nerve or spinal cord, and fusion is done and spacer or cage is placed in between the two vertebral bodies to stabilize the spine. 2. Cervical disc replacement or artificial disc replacement can be done if damaged disc is removed and replaced with the artificial disc and preserve the neck movements. And 3. Posterior cervical decompression or laminectomy or laminoplasty or lateral mass fixation for multi-level compression and cord involvement from the back side of the neck. Recovery: most of the patients able to get up and walk on the same day or next day. Most people return to the desk job within 2 to 3 weeks, and most of the people may recover fully in 4 to 6 weeks with physiotherapy and posture correction, depending upon the condition and clinical examination when they are examined first. And these are the few things about text neck we have discussed. And if you feel it is useful, please share with your colleagues. And thank you for watching and have a nice day. Please contact if any doubts. Thank you.